Namaste and good evening. Happy World Physiotherapy Day to the whole physiotherapy fraternity. This COVID-19 era has taught all of us so many things inside and out. Right? As a part of this, I, Dr. Anjali Bhimajani, District Sub-Coordinator, IAP Women's Cell Gujarat, welcomes you to our Community Awareness Seminar on COVID-19. COVID-19, as we all know, is affecting all of us. And now, when there is unlock is going on, we are very fragile, threatened that what if our loved one or we get this. The mortality rate is not that much high, but the isolation period, the care, and the panic atmosphere fears us, right? I am also a person who fears for myself as well as my family and my loved ones to prevent or to fight against this. We all have to, as a team, as a unity, as a community. So from the physiotherapy community, I have come to you to use basic physiotherapy techniques to prevent and to recover from this COVID-19. It's good if you haven't touched that. It's good if you haven't infected by this. But many of us have problems of home isolation or hospital care accommodations during this. Lack of knowledge and awareness, and of course untouched or less touch physiotherapy field is respiratory field. Society don't get their help, but here now we are committed to give you our best. As physiotherapists, we can prevent this with respiratory training. We can improve your health with mental and respiratory training, with exercise, and during mild to moderate symptoms, we can help to get up early and get back to your previous life as early as possible with exercises. And also the weakness, the breathing problems and problems after COVID-19 infected means post-recovery problems are there. Physiotherapists play crucial role all over here in general well-being, in mental health, and also and very crucial part in respiratory syndromes. So in this webinar or seminar or awareness program, I am today going to show you all these three aspects of us. Stay connected. First of all, in preventive part, we all know government guidelines to wear mask, frequent hand wash, and less popular thing is steam inhalation, right? You all know wearing mask, social distancing, and hand wash techniques. Hand wash techniques which we have to pour a drop of any soap, rub hands like this first, then back of our hands, then cross our hands, then our fingers, right? Nails part, right? And then our thumbs and back of our hand, and rinse hand thoroughly, right? This is a standard procedure how to wash your hands. We all know that all ad is coming like wash your hands this way, and thumb. We all know. Mask here, N95 mask and surgical mask. Two types of masks are there. But we can also have the dupatta or gamcha as our Prime Minister Dr. Modi has suggested it. Right? All this is thing. The other thing is social distancing. In country like India, it's quite difficult to have social distancing, but we have to manage this. The other part is steam inhalation. Everybody is talking about steam inhalation. Here, I am going to show you the right way of steam inhalation. Right? Will you see it? Okay. You all may have a steamer like this. A steamer. Or if you don't have it, you can have it very easily at your nearest medical store, or you can have it with your basic home remedies like a tumbler or anything in which you pour boiling water and you can inhale that. Now, the reason behind this, we sanitize our hands. We can sanitize the things we touch. The real reason behind steam inhalation is also this. Inhale steam sterilize your nasal pipe and the feeding pipe, from where coronavirus can go further to the lungs and affect. To sterile and sanitize this part, this procedure is used. Now, how to use it? You are taking this, inhaling the breath, but how many times? How much? It's a question, right? So, with this, you have to have a inhalation part. You have to have a towel and put it like this, and you can breathe like this. The aim should be to inhale the steam via nose and via mouth. So the simple and easiest trick is that inhale steam via nose 10 times and breathe out pursed-lipped. And then after 10 to 12 breaths, you can inhale actually the air or the steam through mouth. In our thing, it is called gulping the air. So, the steam and the properties of steam will help you to fight the coronavirus if it is there. This is first thing. The second thing, which I have mentioned in inhalation technique, very crucial thing. We all are knowing, all are telling us to take deep breaths, improve your vital capacity. Vital capacity, yes. What is vital capacity? Vital capacity is air consumption done by your lungs. A lung capacity to inhale air as possible as there during normal breathing. As athletes and swimmers and other sports persons have this, they have improved their vital capacity. This will reduce risk of any infection and atelectasis or pneumonia which can be there after affecting COVID-19. Right? COVID-19 mostly affects our lower part of the lungs. So, respiratory, first we have done with steam inhalation, respiratory clearance, and the second thing, we are going to learn breathing techniques. Breathing techniques here, first and the foremost thing is pulse lip breathing, in which we inhale the air through nose and with rounded mouth we exhale. Here I am showing you the technique. Please try to do with me. Okay? Ready? Take a deep breath. Exhale as much air as you can through your mouth by rounding your lips. Again, See and practice it with me. This improves your breathing capacity. And have you felt that? The peace in mind? Yes. A mental health project, right? So doing deep breathing helps us to improve our respiratory and vital capacity and also our mental well-being. We'll do this thrice with each other. Let's start 3 times. Practice it with me. Okay? Start. Very good. Again. Last time. Take a deep breath as much as you can and exhale. Right? Here, exhalation should be as long as possible. Now, it's time to learn a new breathing technique. Actually, it's not new, but to explain it's new. That's diaphragmatic breathing. We all know about diaphragm, right? In school, we have done that project, lungs and dome-shaped thing below that creating pressure, positive and negative, and air gulls in and out. Right? Yes, that diaphragm. Here's. For that, abdominal breathing is the term. To relearn this technique of our body, you just have to put your both hands on your stomach and take a deep breath. Feel the movement of air in your abdomen. Feeling? Yes, that's it. That's a diaphragmatic breathing. Now it is time for basic exercises. Here I am not going to show you, or I am not giving you time to do it with me. Just showing you basic exercise as quick as possible, which to prevent corona you can do by yourself at your home. I will suggest you should do this whole family. I means with whole family. Whole family should do this in the morning together to improve your immunity and your basic fitness. It is high time to pursue some goals about fitness if you are not a fitness freak person. Let's start it. First, we'll start as we have talked to. We are going to have our mental, general well-being and breathing capacity, all of these 3 things together. So, with mobile and screen time, we have to do eye exercises. So, we'll start with the basic eye exercises today. Let me show you all the exercises step by step. Stay connected. First one. Keep your finger in front of your eyes. Move it upward and downward. Upward and downward. Then right to left. Right to left. Right to left. See your fingertip only. Right to left. Then to your nose and to the L's. To your nose and to the distance. To your nose and to the distance. Don't move your eyes above your finger. Right? And last one is make small to big circles like jalebi with your fingertip. Clockwise and anti-clockwise. Smaller. Your eye muscles are exercised now. You should do this in thrice a day because we are using mobile screens so much, right? Now again, next part coming to our head. As mobiles are there, we are always this. So neck muscles have to be relaxed and motioned, right? First one is no, not this one. First you have to go up and down. Fully good. Sideways. Yes, very good. And round clockwise. Touch your ears to your shoulders and anti-clockwise. Very good. Now it's time for your shoulder. Straight shoulders and make circles like this. Yes. Small circles. 10 clockwise and 10 anti-clockwise. Very good. This will too open up your chest. So keep deep breathing. Very good. Doing good, guys. Now up and stretch. Stretch. Hands up. Stretch and sit on your toes like this. Maintain this for 20 seconds. Seeing this? Okay. Again, a chest opening exercise. Shoulder downs by putting your hands on the shoulder. Full range clockwise and anti-clockwise. When open your arms, inhale, and where arms are coming to the body, exhale. Reverse. Getting it? Now, again, small muscle exercises to pump your blood to every part of your body. Keep your arms straight. Just open and make fist. Very good. After 10 times, just up and down your wrist. Straight your hands, up and down your wrist. 10 times. Very good. Now, touching your shoulders and straightening your hands. Touching your shoulders and straightening your hands. Very good. Now, it's time for your back. Ready? 1, 2, 3, 4 and 5. Getting it? 1, 2, 3, 4 and 5. The extension here is very important for your improving vital capacity. Lungs vital capacity may or may not be affected, but our posture, the posture which we getting by sitting is interrupting due to muscle tightness our capacity. So while you extend fully your back, you are giving your lungs and rib cage more space to move. This will help you for deep breathing. Okay, so we have done basic rotation of hands and extended our back. Now it's time to move your pelvic and come clockwise and anti-clockwise. Then to your toes. This is a balance exercise come a general pumping exercise for legs to improve your blood circulation. So 10 clockwise and 10 anti-clockwise. Now you have warmed up enough. Now here for improving your aerobic capacity and general fitness, the exercises start. And the first exercise is 2, 3, 4, 5, 6, 7, 8, 9, 10. Have you noticed I have up and down my knees, a balance exercise, right? 1. So I should not move like this. It should be straight. Hands are going up and down to help my lungs to expand fully. First exercise. After this, doing for 30 seconds or around 60 repetitions, you can have rest. In rest, what you have to do is inhale as much as you can and exhale through your mouth in 10 tiny slots. I will show you. Repeat this 3 times. What is the logic behind this tiny exhalations? Tiny 10 exhalations will exhale whole restricted air in your lungs. If whole air is executed, then you can inhale better, deeper with more oxygen. This will improve your oxygen level. Please note, what am I showing here is for healthy individuals, and till then they are not having any breathing problems or any other problems. During fever you can't do these exercises. Okay, now again join. We'll move to next exercise. Here we have done this, so now we are doing this to open up our chest for bucket handle movement. Right? 1, 2, touch your toes. 7, 8. Okay? 30 times. After this, you can follow the deep inhalation and pause lip 10 slots breathing. Okay? Now, are you feeling wet? Yes, I am. Oh, it's time to have water. After breathing techniques, I would like to share some information about exercise to you. Exercise 30 minutes a day, 5 days a week. Aerobic exercise, that is walking or cycling or any exercise like step up or even dance with music, can boost happy hormones in your body. That is good for mental health during this crisis. And some other things I would like to share, that only mild to moderate exercises are recommended. High intensity exercises, who are not a fitness freak or regular exerciser, should not increase their intensity of exercise during this era, because this can lead to inflammation of the muscles and can decrease your immunity. Understood? So, mild to moderate exercises, that is 30 minutes a day at low intensity to moderate intensity 5 days a week is recommended for good immunity. 2 more information I would like to share you. That is, with all the exercises and precaution, you should be hydrated. Hydrated here I means you should at least take 3 liters water during the day, because this reduces toxins to our body due to stress and other weather changes. So staying hydrated is a booster for immunity. Right? Now the next thing I would like to share you is follow your body rhythm. A great schedule, 8 hours of proper sleep, rest and good nutrition. These are key to basic immunity. We should follow this on regular basis. But in crisis like this, pandemic, we should focus more and more on this to take proper rest and proper healthy nutrition. Take care. That's enough for precautional measures. If you have questions, send us in comment section. We'll discuss it later. before coming to the second part, I would like to share one more technique with you, that is active cycle of breathing technique. Here we have to deep breath, hold it for 5 seconds, exhale fully as much as we can, and then hold the whole air outside for 5 seconds. A square should be maintained, right? Let us practice this with me. Okay, take a deep breath. 1 2 3 4 5. Hold it. 1 2 3 4 5. Yes, now exhale fully. 1 2 3 4 5. Now exhale the complete air outside. You are not going to inhale any air. 1 2 3 4 5. Okay, now inhale. Ready? Again we'll do this. I will show the demonstration. Start. Hold. Exhale fully. Inhale again. This, every individual should do this at least 5 times a day. I means 2 to 3 times, different times a day to maintain their lung vital capacity. Hope you are doing this. Now, coming to the second and crucial part of physiotherapy treatment, mild to moderate symptoms. Many of us are having corona positive test but not having any symptoms. This could be happy hypoxia. It sincerely means that patient is not having hypoxia, that is lack of oxygen level any symptomatically, but with oximeter like this is very easily available in the market. You have to just put your finger in it and measure your oxygen level. So I would suggest any mild to moderate symptom patient who are quarantined or living alone at their home or any suspension should measure frequently their pulse oxygen level, that is SpO2, and their pulses. Here I am measuring this. It should not be below 93 during exercise, right? So before exercising you should measure your pulse oximeter. Now every quarantine patient should be aware of dyspnea, that means breathlessness. When there is breathlessness, a patient should take such support and bend or lean forward and take breathing. This will activate your accessory muscles and give your respiratory muscle a break and improve your oxygen level immediately. We teach generally this technique to asthmatic patient, or else you can also sit to like this, leading band or with support forwardly, right? You can also support at a corner. This is when you feel breathlessness, means dyspnea. The next thing, everybody should check themselves with 30 seconds sit to stand measures. That is, start your timer and measure how many times without being breathless you can stand up and sit on a chair like this, right? 1 2 3 4 5 6 and so on. After 30 seconds you should not be dyspneic and measure the amount. You can, the number of your up and down should be noted, right? Another test, a self test, is 6-minute walk test. Wear your oximeter and walk around the longest corridor you can access for 6 minutes and Continuously measure your SpO2, should not be dropped. These are self-training to check your position, to contact with your doctor, and should be noted in a paper, right? Now, I am going to show you some exercises which you can do when you are not having fever and not having any breathing difficulties by yourself. But measuring your health by yourself is very important here. When you feel better, you can try deep breathing and diaphragmatic breathing, which we have shown earlier in this video. The other thing you can try is exercising when you are sitting. Have a chair or bedside and start mild exercising to improve your general health, because as I know, the muscle pains are very symptomatic during COVID. General weakness can also be improved with this, right? So rest is very much needed, but when you are feeling better, do yoga, do meditation, do deep breathing and some mild exercises. Which exercises you can do? I will show you. Sit like this and have heel and toe raise alternately, or have heel raise. Yes. Can you see this? Yes. 20 times. Then toe raises. Very good. If you feel comfortable, go further with lifting your legs to mobile early and less fatigue after you get out of your quarantine period. Take rest between if you need some, and you can also have some hand movements. Sitting or standing is your choice. I would suggest you should take short walk within your quarantine room to improve your general health. Rest, but activity is as much needed as the rest is needed. Understood? Now, you can also have the breathing exercise with hands up and down. This will lead to improve your capacity, lung capacity. If you are having oxygen, you can do with oxygen also. Very good. Sideways. Here, when you open up, take a deep breath. Exhale while going down. Exhale while going down. Very good. Keep it up. Go to 10 to 15 till 20 repetitions twice a day. This will help you a lot. Then, if you are doing this much comfortably, then going further to twist. Yes. Inhale. Exhale. Inhale. Exhale. Or you can do it either way with footwork. That is, inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Exhale. Very good. Improve this intensity with music, your favorite music, and as your body supports you. One more thing I would like to share you is the positioning. As all doctor has suggested, you are trying and practicing the prone positioning, right? To improve your health, to improve your lung capacity, to improve your breathing capacity. I am showing you the proper positioning for prone, and with that I am going to show you two more positions to excrete your secretion with the help of gravity. As you will feel comfortable and recovery is starting, you can try this breathing exercises with dupatta or therapy. So have this position, open and cross to your hands. Inhale and press it, the lower part of the lungs. And exhale and loosen. I will show you better way. Now inhale and exhale. Inhale, exhale. You can do this with your hands also. That's inhale, exhale. Press during inhalation your sides and during exhalation loosen up. This will help your respiratory muscles to be activated, right? So start. As well as spirometers like this can also be helpful. These are the devices you can use to measure your lung capacity by yourself. Here 3 balls are there, and as you inhale the balls will get up, and as you exhale, for exhalation you should be do it in reverse position. As you exhale, this will also get up. I am going to show you the tricks. Okay? Keep this mouthpiece in your mouth and make it lock. Now inhale. Have you seen this? You can do this by yourself at every 2 to 3 hours. For exhalation, again same position of the mouthpiece, reverse the spirometer and exhale. Practice will make you perfect with this. Now coming to the third phase, the recovery and physiotherapy phase. In rehabilitation after COVID-19, we have to fight main tasks of fatigue, weakness, reduced daily or functional capacity, and pulmonary problems. Here, our goal for first 2 weeks is to get the person to their ADL without any interruption. So, basic breathing exercise, good nutrition and hydration is all the things we are going to have. And basic light exercises we are prescribing. Along with all this, some cognitive function dysfunctions like balance problems are also noticed over some patients. So, we have designed an exercise program to fight all of this. Now, I am going to show you the exercise. In rehabilitation phase, we are going to start the exercises with basic rotation, which we have shown further in the prevention techniques. And then gradually we'll have 2 static exercises of lower limbs to fight the fatigue and weakness and the problems during ADLs, right? So we'll have up and down of heels, static marching, and squats and lunges, side lunges, and then rest, deep breathings and hydration. After this, we can add up and down of stairs for a flight to 2 and walk for 10 to 15 minutes without dyspnea. Gradually, we'll increase the repetitions of the exercise from 5 to 10 to 15 to 20 and then get back to your normal life. With all this, one leg standing of either leg should be practiced to enhance your balance if it is affected. And with this, you can improve your general capacity. And for pulmonary function, you can continue practicing the spirometer and the resisted exercise with the TheraBand we have taught you. Static marching is a good aerobic exercise to improve your general health. By here, I should take your leave. Stay blessed and exercise. In COVID-19, we have learned that movement is medicine.